Hi, I'm Leslie Joseph. I am from Nightingale BSN 246. I am wearing my Nightingale scrubs, and this is my Nightingale patch. I have gathered all my supplies for the insertion for the IV. This is a 22 gauge needle I'll be using, a normal saline flush. This is a catheter extension kit with a Lurlock IV start kit. This will stand as my sharps container and my sanitizer, 0% for hand washing, okay, and my gloves and my pen. All right, so we received an order from the doctor for an IV hydration. So for the IV hydration, it is proper to use a needle at 22 gauge. Right. So before we head in to the patient's room, we have to make sure and verify the orders. We have the order, right patient, right procedure. Okay, so we go to the patient's room. All right, sanitizer was outside the patient's room, so I'm doing sanitizing my hands. Okay, knock, knock, knock. All right, hi, may I come in? Okay, thank you. All right, so opening the curtain, closing the curtain right behind me. All right, so hi, I'm Leslie. I'll be your nurse for today. We receive an order from the doctor that will be inserting an IV for your IV hydration. Is that okay? Okay, thank you. Can you verify me your name, please? Allison Joseph. Allison Joseph. And your date of birth? August 17, 1985. August 17, 1985. We also check for the wristband. Allison Joseph, August 17, 1985. Okay. All right. So do you have any questions? No questions. All right. So do you have any allergies? No allergies. Okay. So I have my supplies with me. I'm gonna make sure and prepare everything before I insert the IV. All right. So put my gloves. All right. With that, we're gonna be using a septic technique. All right, this is my normal saline. Getting my catheter extension kit. You want to make sure that we do not touch the end and keep it sterile. Okay, attaching the normal saline. Oh, right, sorry, that was for my practice. We have to make sure that there is no bubbles. All right, there is no bubbles. Set that aside. I'll dispose this. All right. Okay. Gonna grab my tourniquet. And with the tourniquet, we're gonna be doing the arm. So I'm applying it 4 to 6 inches above the insertion site. We have to make sure that we do not apply too tightly. All right. Checking for distal pulse. There is. Okay. And then now we're going to be cleaning it with alcohol swab. When cleaning, we have to make sure we're doing it from inner to outer. All right, cleaning it from inner to outer for 30 seconds. Okay, let's pretend 30 seconds is done. We have to make sure that it is dry, checking for dryness. All right, so before I insert the needle, do you have any questions, Miss Allison? Okay, all right. No questions. All right, so I'm gonna anchor the vein 1 to 2 inches, 1 to 2 inches above below the insertion site. All right, I'm gonna gently stretch the skin on the bottom. Okay, and then this is the tab. We have to make sure that it is facing me. Bevel is up. Making sure bevel is up. White tab is on top. White tab is on top. Bevel is up. All right, I'm gonna anchor the vein 1 to 2 inches again below the insertion site. Bevel is up. We're gonna insert it with a 30 to 45 degree angle. All right, inserting 30 to 45 degree angle. I see a blood. There is flashback singing. Flatten out the tip. Then we advance the VAD approximately a 1/4 inch. Then we advance the catheter, advancing the catheter off the needle, okay, until the hub reaches the insertion site. Is at the insertion. All right, we're pushing. All right, it is there at the insertion site. All right, the device we hold. Right, this. We click the white tab, put it right away in the sharps container. All right, I immediately put that in the sharps container. I stabilize the catheter using my non-dominant hand. I release the tourniquet, releasing the tourniquet while touching. Now I connect the lure lock. The one that we primed a while ago, we connect it, connecting the lure lock tub tubing to the catheter hub and secure the connection. All right, we have secured that. Right now we are checking for blood return. Checking for blood return by pulling. We do not push the normal saline yet. Pulling, pulling, pulling. We see a blood return. Now we slowly flush the normal saline. Pushing normal saline. The IV is pushing easily with no pain, no redness, no bubbles around that IC, no leakage. There is no signs of infiltration. Are you okay, Miss Allison? Okay, you are okay. So patient, there is no discomfort with that. Then we clamp. We clamp it. All right. So now I remove the syringe and discard. All right, now I'm gonna get my Tegaderm dressing, and we're gonna apply it on top to make sure that our IV here is secured. Put it right there. And then we grab the white part. Okay, it is secure. And now we're gonna label. Use this part, the white part. There, we're gonna put in our initial, the date, our initial, and the syringe that the syringe type or needle that we used, which is today is June 13. Sorry, should I say June 14, 2026. The length, it is 22 gauge. We're using 22 gauge and my initial. You put it there, make sure it is visible. All right, and then now I dispose everything that we have used. Right away. And throw everything. Remove my gloves and wash my hands. Okay, Miss Allison, how are you? Do you have any pain? No pain? Okay. All right, now you are all set for your IV hydration. You have a good day. Thank you. Okay. All right, so we received an order for discontinuation of IV. Now this is a skills video for me to show discontinuation of IV. All right, so we're gonna verify orders, status post IV hydration. There is we are now okay to discontinue the IV access. All right, so visible orders seen. Go to the patient's room. Knock, knock, knock. All right, hi Miss Allison. I am Leslie. I'll be your nurse for today. So now it is, we received the order from the doctor that it is now okay to discontinue your IV since your IV hydration is done. Okay, all right, performing hand hygiene. I apply my gloves. All right, so now I'm gonna carefully remove the dressing and while stabilizing the IV. All right, so now we're removing the tape here on the side. All right, right, I'm gonna be stabilizing the IV catheter while I'll pull on the dressing on the side. Okay, now I'm pulling, stabilizing the IV. All right, now I'm gonna grab a gauze. All right, put it on the insertion site while I withdraw the catheter slowly in a steady motion while pulling and keeping the hub parallel to the skin. I'm pulling, pulling, pulling. Now, while applying pressure for a minimum of 30 seconds, I am also inspecting the catheter. All right, inspecting the catheter, it looks like this is a 22 gauge. Okay, there is no active bleeding. All right, okay, inspecting. Are you okay, Miss Allison? You are okay? All right, now make sure that the catheter tip is intact from the one that you pulled. Putting it there. All right, now I grab another gauze, fold it. All right, replace the gauze, get a tape. All right, now we put the tape. Okay. And I discard the catheter tip in a sharps container. Before you discard, make sure that you inspect again the catheter tip. Everything is okay. 22 gauge. All right, nothing was left behind in the patient. All right, put it in the catheter. Okay, are you okay, Miss Allison? Okay, and then make sure that there is no active bleeding, no signs and symptoms of infection, no redness, no swelling, no discomfort from the patient. Okay, all right. Now I'm gonna be removing my gloves. All right. And then upon completion, make sure that you document everything, that the patient tolerated the procedure well. We were able to get the catheter intact with a 22 gauge. Nothing was left behind with the patient, and you document the conditions of the site: no redness, no swelling, no signs and symptoms of infection, no signs and symptoms of infection. That is done with a, this is the end of our discontinuation of IV.